So for this video, I'll be talking about cranial cruciate ligament tears, which are very common in dogs and cats. The cruciate ligament is actually made up of two ligaments, one at the front called the ACL, or known as cranial cruciate ligament, and one at the back known as the posterior cruciate ligament. In dogs and cats, we call it the cranial cruciate ligament, as opposed to people where it's called the anterior cruciate ligament. But for the sake of familiarity, I'll refer to it more as the anterior cruciate ligament rather than the cranial cruciate ligament, but we're actually talking about the same thing. So the ACL is torn as the most common injury of the back leg in dogs and cats. I've treated dogs as young as 6 months of age to as old as 14 and 15 years with this injury, and both males and females of all breeds are affected by the condition. So the knee sits in the middle of the leg in much the same position as our knee. Like humans, dogs and cats only have two knees, one in each leg, and you'll obviously be able to feel it right in the middle of the leg. The specific ligament that's injured is actually within the joint itself, and the ligament is thought of or described as a bit like a rope, and think of it like multiple collagen fibers all sort of bound together. Its job is to stop translation between the femur and the tibia. So when it's torn, there's an abnormal front to back motion of the knee, which shouldn't happen. And that leads to pain, limping, arthritis, and all the other changes that we talk about with these injuries. In dogs, we see two types of ACL tears. There are those that we call partial tears and those that are called complete tears. Most partial tears eventually become complete tears given enough time. And in fact, partial tears often cause as much limping as complete tears. It's important for you to know as well that about 50% of dogs tear their other ACL within 1 to 2 years of tearing the first one. Fortunately, there are only two knees in the dog and cat, and other ligaments of the body are not as susceptible to these ligament tears, just like the knee is. What are the symptoms of an ACL tear? ACL tears cause limping of varying severity, from mild lameness to severe non-weight bearing lameness. Many times there is no obvious cause to the lameness, and owners report that it just suddenly began. In other cases, there is an obvious cause. Often owners note stiffness after rest, or difficulty going up and down stairs or jumping into the car. Sometimes owners notice that their pet warms up out of the injury. In some cases, muscle atrophy of the affected leg is observed by the owner. Listen out for a clicking noise that you may hear, which can be a sign of a concurrent meniscal tear. Meniscal tears occur in about 40% of pets with ACL tears. So, diagnosis of an ACL tear. An ACL tear is pretty easily diagnosed on physical examination of the pet. As we talked about before, the ACL's job is to prevent front to back motion or sliding between the femur and the tibia. And so by performing a test that we call the draw test or the tibial thrust test, we can pretty easily detect an ACL tear. A positive draw or thrust is obviously highly correlated with an ACL tear. There are other hallmark features of an ACL tear when we feel a pet's knee, so that can be other things which I won't get into in this video. Another tool that's often used is an X-ray. On X-rays, we can't see the ligament itself, but we can see other changes on the X-ray which are suggestive that there is a cruciate ligament tear. In dogs and cats, MRIs are not often used, mainly because most ACL tears you can pretty readily detect on examination and X-rays, and unfortunately MRIs are relatively costly to perform. Let's talk a little bit about treatment of ACL tears. So these are the most common injury that I treat, and the surgery comes down to what's right for you and what's right for your pet. And there are lots of factors that you need to consider, emotional factors, financial factors, practical factors, before deciding, surgery is the right thing to do to fix the pet. I've operated on very young pets and very old pets with excellent success. So age is not necessarily a factor that comes into play too often. The recovery period. The recovery after any surgery, whether it's a lateral suture, TPLO or TTA, is generally around 6 to 8 weeks of healing. It is generally accepted that pets feel more comfortable on their leg, that is, that they use their leg faster after a TPLO or a TTA over a lateral suture. During the recovery period, we ask owners to keep their pets strictly confined, away from other pets, ideally in a small room or a crate. Good traction flooring such as carpet or runners are important to prevent the pet from slipping over. For the first 2 weeks, we ask that you take your pet outside to eliminate only. Thereafter, pets are allowed to go on leash-only walks, beginning with 5 minutes duration, only for the first 2 weeks. You are then allowed to increase the duration of walks by 5 minutes every other week. Pets should not be allowed to run, jump, or play during the recovery period. It is very important that the pet does not lick its incision during the first 2 weeks while the sutures are present. For this reason, we will ask that they wear a cone collar at all times in the first 2 weeks. We will provide detailed instructions for you to follow throughout the recovery period. So let's talk a little bit about what could go wrong. No surgery is completely risk-free, and every surgeon should advise you of potential complications. Fortunately, complications are relatively uncommon. The main things to be aware of are risks of anesthesia, the risk of infection, which is low but not zero, and infections mainly caused by pets licking and chewing at their incision. There are also the risks of implant complications, so it's important that you follow the post-operative instructions that we provide. Prior to all orthopedic surgeries, I recommend to the clients to bathe their pet in a regular dog or shampoo so that their skin is nice and clean, and that's one little step we can do to reduce the risk of infection. 1 versus 2 knees. There are some dogs that we see that actually tear both ACLs at the same time. The question is, in these pets, whether to repair one or both at the same time. There are advantages and disadvantages in repairing both knees simultaneously. The biggest advantages are that in repairing both knees, there is only one recovery period for the pet and the owner, and one anesthetic hospitalization period, which can translate into less costs in the big picture. The major disadvantage is that the pet finds it harder to walk for the first 1 to 2 weeks. The other disadvantage is that there are more initial upfront costs. The medical literature is divided about whether the complication rate is unchanged or higher when pets have both knees operated at the same time. In my experience, the complication rate is not significantly higher, and pets can return to walking very quickly after having both knees operated at the same time. There is a great video on our website showing an example of a dog after having bilateral TPLOs. I take the approach of assessing each case, including the pet and owner factors, and deciding what is the best course of action. I hope this video has been helpful for your understanding of cruciate ligament tears and their treatments. Thank you for watching.